Thank you for joining us for this episode of Talking Health in the 406, where we are one community under the big sky. I'm your host, Mackenzie Jones, the program manager of the DPHHS Montana Disability and Health Program, which supports the disability community in developing healthy and accessible communities. I am very excited to talk with our guest today about breastfeeding in Montana, the health benefits of breastfeeding, and where to go for resources and support no matter your situation. We have with us today Jessica Keckley and Terry Miller with the Nutrition and Physical Activity Program at DPHHS, as well as Lacey Little and Nicole Bullock with WIC. I will let them introduce themselves fully, describing their professional role and their connection to breastfeeding. I am really excited to have you all here today. Because there are so many of us online, I want to make sure that we all get a chance to introduce ourselves. So if you take a moment to introduce yourself, what is your professional role and what is your connection to breastfeeding?
Hi, my name is Jessica Keckley, and I am a program specialist in the Department of Public Health and Human Services here in Montana. Specifically, I work within the Nutrition and Physical Activity Program, and I'm really excited to be able to work alongside all of these great team members to support breastfeeding in Montana, both through promoting policy as well as a variety of different initiatives that we'll talk through today.
Hi, I'm Terry Miller. I am the Senior Breastfeeding Consultant for the Montana Nutrition and Physical Activity Program. And I get to wear many different breastfeeding hats across Montana in terms of breastfeeding support, education, promotion, and protection.
Hi, I am Nicole Bullock. I am the breastfeeding coordinator for the State of Montana WIC program. So I get to wear the hat in supporting our local agencies with breastfeeding and overseeing our breastfeeding peer counselor programs.
And I'm Lacey Little. I am the state WIC director. So my role with breastfeeding is I help Nicole and help give her tools and resources she needs to run her peer counselor program.
Thank you. And WIC stands for Women, Infant, and Children, right?
Yeah. So our technical program title is the Special Supplemental Nutrition Program for Women, Infants, and Children, or better known as WIC.
And tell us a little bit more about what WIC is specifically and who it supports.
WIC is a nutritional program, but it provides nutrition education, which is a big piece. We're a preventative program. We also provide referrals to different community resources that people may need in their local area, whether it be mental health or food bank networks, or even where to find a dentist that takes Medicaid. We also provide nutrition through our food package. We're a supplemental program, so we provide about 70% of someone's needs in a month based on really specific nutrients. And so our population we serve is birth up until they turn 5. And then we serve pregnant people and postpartum people up, depending on their breastfeeding status, up to a year if they're fully breastfeeding and 6 months if they are postpartum non-breastfeeding. And then we also serve a lot of foster care children. So we have a lot of grandparents and foster families and single parents raising children too, and we support them as well.
So I was told that it is National Breastfeeding Month this August. Tell me about the theme for 2025 and how your work supports these efforts.
Happy World Breastfeeding Week and U.S. Breastfeeding Month. It's August. So every year, the first 7 days, the world celebrates breastfeeding in all its forms. And what it does is it aims to highlight the benefits of breastfeeding and maternal care. Every year, they have a theme. And this theme is breastfeed to support a sustainable environment. And how we can breastfeed and increase environmental protections. So basically, breastfeeding uses no packaging, also uses very little transportation. Breastfeeding is free. uses hardly any water. And also breastfeeding uses no dairy cows. So breastfeeding is just more environmentally sustainable for all of us.
We just did want to note that breastfeeding can be challenging when parents are not fully supported. So that's another goal, is to provide that full support.
So I've heard a lot about baby-friendly hospitals. What is a baby-friendly hospital and how do they support breastfeeding mothers?
The Baby Friendly Hospital Initiative is an initiative that started in the 1970s, 1980s through the World Health Organization and UNICEF. And it's an international recognition. And it recognizes hospitals that do and perform the best practices in infant nutrition and care. And often it takes hospitals around 4 years learning, educating, and implementing these practices to be officially recognized as baby friendly. So that is what a baby friendly hospital is. We are lucky to have 6 baby friendly hospitals in Montana, anywhere from small hospitals like Bitterroot Health to larger hospitals like St. Pete's and St. Vincent's. So like I said, the Baby Friendly Hospital Initiative just works with hospitals to help them support breastfeeding with their families.
How does a hospital become baby friendly? Who do they contact? What kind of steps do they go through in order to get that certification or designation?
Oh, well, that's a great question. So how hospitals become baby friendly are they work with Baby Friendly USA, which is a nonprofit national organization. And they work with the hospital. They also work with us at the Montana Nutrition and Physical Activity Program if they're with Montana. And we provide the technical steps for hospitals to work through. There's 4 phases to work through the different policies and regulations to become baby friendly. So what they follow is the 10 steps to breastfeeding. And those 10 steps would be educating all labor and delivery staff about how to teach breastfeeding. Another step would be to promote all infant care in the room, in the room with the mom and baby. So you're not removing baby from the room. So mom's going to learn about baby and feeding cues. Another step would be on discharge would be to provide all the information on breastfeeding education resources in their community. So those are about 3 of the 10 steps and deliverables that each hospital has to undertake to become baby friendly designated. So it's a lot of work. Every 5 years, they have to go through different plans to get redesignated. And it's a lot of work and a really amazing recognition to become baby friendly designated.
And you mentioned there are 6 baby-friendly designated hospitals in Montana. How does someone find out if their local hospital is designated as baby-friendly?
What I would do is go to the Baby Friendly USA website, Baby Friendly USA, and there is a locator on there. You type in your zip code, and it can tell you all the hospitals that are baby-friendly within your area. Right now, we have St. Vincent, Livingston, St. Peter's, Ravalli, Marcus Gailey, Whitefish, Logan, and I'm missing one.
The Bitterroot Community Hospital of Anaconda.
That's it, yeah. The Community Hospital of Anaconda is our longest baby-friendly designated hospital. I believe they've been baby-friendly designated for 25 years, 20 to 25 years.
That's incredible.
Yeah, they do amazing work in Anaconda. We're really excited to partner with them.
Thank you for sharing those 6 hospitals. And as a follow-up, when a hospital isn't designated, what resources are available for pregnant women or pregnant people in the community, and how do you connect to those resources?
I just wanted to make it of note that just because a hospital isn't designated as baby friendly doesn't mean they don't have any of those supports in place that a baby friendly hospital would. It could mean that they were working towards baby friendly designation. And so it doesn't mean that they're not supporting breastfeeding mothers. It just means that they haven't got that intensive designation. So I just want to note that first of all. So in addition to baby-friendly hospitals, there are other ways that both the community and workplaces can support lactating individuals. Within work sites across Montana, we do have a mother-friendly worksite initiative, which supports businesses in providing a private space, a flexible policy for break times, and a policy that states space and time to express breast milk are available to employees. This does tie back to Montana policies that protect the rights of mothers to be able to breastfeed in public and have those supports in the workplace. And the Nutrition and Physical Activity Program is here to support any facilities that are interested in becoming mother-friendly designated. Just wanted to note that mothers are some of the fastest growing segments of the U.S. workforce, with 1/3 of mothers returning to work within 3 months after birth. So breastfeeding support from an employer can help reduce barriers a mother encounters when returning to work.
Thanks, Jessica. And I'm going to ask the WIC folks, Lacey and Nicole, if mothers that qualify for your programs, where can they go to access services?
Yeah, mothers that may seem eligible for our program if they're on Medicaid, SNAP, TANF, FDPIR, a slurry of eligibility programs. They can go ahead and they can actually go to our website if they want. And there's a signupwith.com, and they can type in their zip code and it'll give them the nearest clinic to them. Not all of our agencies have a breastfeeding peer counseling program, but all of our agencies have staff that are that have breastfeeding training, and they do have breastfeeding coordinators and things like that. So we have been working very closely to get our breastfeeding services spread out across the state by asking some of our larger agencies to supply breastfeeding for counseling services to some of our smaller communities so that we can still continue to reach all the families that we can. But the quickest way to get to our services is to visit our website, and then they can type in their zip code to see where the nearest clinic is to them.
Thanks, Lacey. And I have heard of the resource Zip Milk, where someone who's breastfeeding can type in their zip code and access resources. Is that available in Montana?
Yes, Zip Milk is available in Montana, and it's really simple. So you just go onto Zip Milk website, and you can either search by state or you can search by your zip code. You put in your zip code, and it brings up breastfeeding resources that are available within your area, whatever that area might be. And these can be local WIC offices, breastfeeding classes from your local health department. It could be a private lactation provider, and it just has that information on how to contact them. So that would be Zip Milk, and it's a great resource, especially in Montana, where, especially in our rural areas, it might be harder to find lactation support.
Thanks, Terry. A follow-up question to your conversation about mother-friendly work sites. Is there a way to know if your work site is mother-friendly, or a website they can go to encourage their work site to become mother-friendly?
Yes. So the Montana Nutrition and Physical Activity website does have a list of designated mother-friendly work sites. So you can check that out on there. That does not mean that your work site is not mother-friendly by any means. And we do encourage you to talk directly with your employer. As I mentioned, there are policies that support individuals who want to express breast milk. So there is a Montana code, Nursing Mother and Infant Protection. So in this code, the Montana legislature finds that breastfeeding a baby is an important and basic act of nurturing that must be protected in the interests of maternal and child health and family values. So a mother has the right to breastfeed, and the mother's child in any location, public or private, where the mother and child are otherwise authorized to be present. So knowing that right is really important. Whether the mother is covered or not is also covered in this annotated code. There's another Montana code for public employers. This policy is on unlawful discrimination and states that all states and county governments, municipalities and school districts, and the university system must have a written policy supporting women who want to continue to breastfeed after returning from maternity leave. And it is unlawful to refuse to hire, employ, or bar to discharge an employee who expresses milk in the workplace, or to discriminate against an employee who expresses milk in the workplace in compensation or in terms, conditions, or privileges of employment, unless based upon a bona fide occupational qualification. Essentially, there are codes that protect individuals who wish to breastfeed in the workplace, and I encourage you to. We will follow up with those after the podcast, and you can check out those resources, and always contact the Nutrition and Physical Activity Program if you have any questions about your breastfeeding rights in Montana.
And you might have mentioned this, Jessica, but just in case, also the Affordable Care Act has the lactation accommodation law. So basically, that's a law for all employers across the U.S. where they need to provide a space for an employee to pump that's not a bathroom, and time for an employee to pump during their breaks. And they have to provide that for up to 1 year. So that is actually a national law, and most employers can easily offer that at their work sites. And if you do that, if you have a place to pump for moms, and it's not a bathroom, it's private, and have a policy, which is kind of our Montana twist on it, and you provide that and you outreach to the NAPA program, we can easily designate you as a mother-friendly worksite. And what you get as a mother-friendly worksite, you ask? Well, what you receive is recognition on our NAPA website as a mother-friendly worksite. You also receive a certificate and a decal you can put on your door or your business to notify everyone that you are mother-friendly and you are providing those supports. So we'd be happy to recognize any worksite in Montana as mother-friendly.
And as a follow-up, for any work sites that may need additional financial support or in rural areas or tribal communities, is there funding for them to apply for in order to help them to become mother-friendly?
That's a great question. And there isn't funding, but we do provide free technical support. So say you're like, oh, how do we set up that? What do we have in our office that we can make into a private space? And we will work with that employer to make that happen. Whether we can retrofit a broom closet. We've done that before. We have worked with a manager's office, and we've made that manager's office locked, and that can be used for an employee that needs to breastfeed. The manager would just leave during the break hours. We've actually even helped people order different, like a tent that they could bring into their coffee shop area outside that they could provide for a lactation space. So we can do all that for free. We can also help provide policy templates to set up a lactation policy. And like I said, we do all of that free of charge. So we don't have any scholarships or grants per se, but we will work with every work site to make it happen for them.
Thank you, Terry.
So just as far as rural areas go in Montana, we know Montana has a lot of rural communities, and we do support the training of individuals who wish to become lactation specialists across Montana, and specifically in rural areas. And so even if you just need that extra support on that side of things, we can help to put you in contact with lactation specialist if that is of interest. If they're not available in your area as well, we can do something like virtually as well. We can help to set that up. So there are a lot of really great supports that we can make happen. Just knowing that those are out there and that we're happy to put you in contact with those is a great first step.
Thanks, Jessica. And that was a good segue into a question about certified lactation specialists. Are there different levels of certification, and what kind of training goes into those different levels?
Well, there are many different levels of lactation specialists, and it kind of depending on what region you're in, whether it's the East Coast, the West Coast, or Central, you might have different names for each qualification. So the highest level of lactation certification is called an International Board Certified Lactation Consultant, also known as an IBCLC. And that is kind of the gold level in credentialing. It requires years of actual direct lactation work with families. It requires advanced level education classes in college, like nutrition and anatomy and physiology. And also it requires like lactation specific education. So a lot of times, a lot of nurses or people that are in that healthcare field have an easier way of becoming IBCLC. Kind of the next level down is a certified lactation counselor, a CLC. That's what they're known as in Montana and the kind of our area. They also could be known as LCs, lactation counselors or lactation specialists. But for Montana, we seem to have a lot of CLCs. Now it is a 90-hour course on lactation education specifics from anatomy, working with breastfeeding moms. It requires you to take some competencies and also an examination at the end. In Montana right now, we're running between 150 to 200 CLCs. We used to have more during the pandemic. We kind of saw a drop in just CLC credentialing overall. But we do happen to have per capita the greatest amount of CLCs in the U.S. And we, like Jessica said, we do offer with partnership with the Montana Hospital Association, CLC scholarships for rural hospitals, community access hospitals. And it's a great program. I think we've awarded over 100 CLC scholarships to date for our rural hospital partners to become CLCs. Oh, peer counseling, that's in there too.
Yeah, let's talk about the peer counseling program. How did that get started? Who can be counselors?
So for the WIC peer counselor programs, the local agencies have to apply for the program. And I believe we have 15 local agencies right now that do have the peer counselor program. And our peers are people who usually they fit the peer scope, I should say. So they usually are same age range as our participants, usually from within the community. They have also been WIC participants in the past or currently themselves. They do have breastfeeding experience as well. We do not want our peer counselors to have credentials such as healthcare providers or anything like that. If they are going to go on and get their certified lactation counselor certificates or anything like that, we want to move them into a different role within WIC. But our peer counselors are there to support our breastfeeding mamas who are expressing breast milk for their infants, whether that be pumping, nursing, any form. And so they usually have had that breastfeeding experience themselves.
Thanks, Nicole. Lacey, would you add anything more to the program?
I would just say that the breastfeeding peer counseling program is newer to the WIC world. It was started in the early 2000s, and it's been a program that has continued to grow for the most part. And as Nicole said, we do have 15 agencies. When Terry was talking about CLCs and IBCLCs, Montana WIC program has been trying to encourage and support staff when appropriate, where they can stay within their scope, to get those certifications. And so, we definitely can see between our program and their program, a continuation of services and a continued support for breastfeeding services in Montana.
In addition to the peer counseling, I also saw on your website a description of the Montana Breastfeeding Coalition and Breastfeeding Learning Collaborative. Can you describe the difference of those two?
The Breastfeeding Learning Collaborative is our annual breastfeeding nutrition conference that we hold every year, usually in the spring. And it is facilitated by both the NAPA program, the Nutrition and Physical Activity program, and WIC. And it has been a wonderful partnership. I believe we're going on our 15th annual collaborative. Our last collaborative was held last month or in May, and we had almost 200 healthcare, perinatal providers and supporters from across the Montana and also from, I think we had some from Texas. It's getting known as a really robust and educational conference. And we bring in speakers from all over the U.S. And also local speakers to talk about current evidence-based practices in breastfeeding and infant nutrition and maternal care. The Breastfeeding Coalition is a coalition of like-minded breastfeeding organizations that support breastfeeding, whether that be WIC, healthcare providers, the NAPA program, and it's just a loosely based coalition that tries to bring in organizations that support infant nutrition.
So this is a podcast, Talking Health in the 406, which is aimed at sharing stories around health and community health in Montana and really thinking about chronic disease prevention and health promotion. Today, we've talked a lot about breastfeeding within the healthcare system and supporting mothers through our public health programs. But what are the specific health benefits of breastfeeding for a mom and a baby?
Breast milk is one of the best sources of nutrition for most babies. As the babies grow, the mother's breast milk also changes to meet that baby's needs, which is really unique. The breast milk shares antibodies from the mother to the baby, and these can help babies develop a strong immune system and protect them from illnesses. Breastfeeding has a lot of health benefits for the mother and for the baby. It can also help to reduce mother's risk of breast and ovarian cancer, type 2 diabetes, and high blood pressure. And for the baby, those who are breastfed have a lower risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, ear infections, sudden infant death syndrome, otherwise known as SIDS, and gastrointestinal infections like diarrhea and vomiting, as well as necrotizing enterocolitis, or NEC.
I can share a little story about working with a new mom, first-time mom, on breastfeeding. And I think I was her third lactation counselor she had seen. She was having a real tricky time getting the latch down and also producing enough milk. And we, as I was her third lactation consultant, we were still looking for that golden nugget, that one thing that would make it all work. And sometimes breastfeeding can be really tricky, and it can put a lot of pressure on moms to do it right, make it work. And we weren't finding that right thing to make it all happen. And this mom was getting tired and exhausted. And what we decided was to change the expectation. Breastfeeding, or the act of breastfeeding, brings a lot of benefits. You don't actually have to have that milk transfer taking place. What we can do is something called skin to skin. And we can do skin to skin whether you're bottle feeding formula, bottle feeding pumped breast milk, or breastfeeding. And what is skin to skin? Skin to skin is baby's chest on mom's chest. Just as easy as it sounds, skin to skin. And what does skin to skin do? It regulates baby's body temperature, which is especially crucial for preterm babies. It reduces the infant's stress rate by regulating that infant's heart rate and breathing rate. This is just basic skin to skin. It enables colonization of mom's friendly bacteria from mom's skin to baby skin, which reduces infections. It promotes bonding, baby and mom emotional connection and attachment. And it teaches moms feeding cues, those cues when babies are just opening their eyes. That's a great time to feed baby, whether it's breastfeeding or bottle feeding. And it also promotes the release of feel-good hormones. So we can do all of these amazing benefits for baby and mom without actually breastfeeding, but by doing skin to skin, which you can also do by bottle feeding. So sometimes moms might not be able to reach their breastfeeding goals, and there can be a lot of guilt with that, but we can change that expectation and make sure we're teaching the benefits of all the other important parts of just attaching with your baby. Because we never want to make moms feel really guilty about not making everything happen. So I think that sometimes we can really promote all the great parts of caring for a baby and the great parts of breastfeeding by skin to skin. And also, other family members can do it. Dads can do skin to skin. So I just wanted to share that.
Like you said, it's really important to be supportive of all mothers and parents and understanding where they are at and coming up with strategies that support their health and the baby's health as much as possible, no matter what that looks like.
What we know now is that 60% of mothers are not reaching their breastfeeding goals, whether that breastfeeding goal be 1 week, 1 month, or 1 year. So I feel that our programs should be focused on not looking at making sure moms are breastfeeding for the American Academy of Pediatrics recommends breastfeeding exclusively for 6 months, and then followed by breastfeeding and complementary foods for a year, and then breastfeeding for 2 years and beyond, as long as mutually desired. And that is a lot. If you are a mom and baby and family, and it's the first few nights of breastfeeding, and you're seeing that I got to do this for 2 years or a year, it can be really overwhelming. So we really try to focus on our programs to meet moms where they're at, wherever their breastfeeding goals are, 1 week, 1 month, 1 year, wherever it's at, we try to focus on that and not focusing on those tick boxes of what they're supposed to do.
I just want to echo what Terry said, right? You know, in WIC, we talk with our families about what are your breastfeeding goals. So we really try to be there and be encouraging for whatever their goals may be, and they may change. And that's what we are here to do, is to help support. And so, you know, like Terry said, whether it's 1 week, 1 day, you know, 1 month, you know, I think everybody is here to just try and support for whatever their journey may be.
In addition to supporting breastfeeding moms through WIC, do you have programs that support or provide financial support in order to get formula or other forms of food for the babies?
So in our program, we do provide formula for moms that choose not to breastfeed. That is just a standard part of our program. They get, again, we're supplemental, so it's not 100% of their needs. And so if we have families saying that they need additional assistance, we will guide them to resources in their communities that might be able to help. Our locals are amazing, and they know all the tips and tricks for their communities. And so the family can just reach out to their local clinic, and they will help try and connect them to whatever opportunities might be in their area. We do have a lot of kiddos that may be on specialty formula for one reason or another. And we will work with those families as long as it meets our regulation requirements to help get specialty formula shipped, which can help alleviate some of that financial burden, because, you know, we all know specialty formula can be pretty expensive.
Thinking more about the health benefits of breastfeeding, I have heard the phrase when thinking about tribal efforts and tribal communities, milk is medicine. I know we don't have a tribal or indigenous representative with us today, but I did want to ask about milk is medicine and whether you know of resources where tribal communities or indigenous people can go. We did a podcast with Amy Stiffarm, and people can go and listen to that podcast about her experience with breastfeeding as an indigenous woman. Terry, do you have any thoughts about other resources for indigenous mothers?
Yes, I do. So milk medicine looks at breastfeeding through more of a holistic perspective. And I would encourage anyone, any of our tribal communities that are interested in looking at milk medicine, to look at the Milk Medicine Collective. It is kind of steered by Amy Echohawk, and It is where Indigenous Milk Medicine Collective envisions a world where Indigenous communities are transformed and uplifted with access to the tradition and knowledge of milk medicine. And that is with the Milk Medicine Collective. And I highly encourage anyone to go to that website and learn more.
Another phrase that I've heard is liquid gold, or breast milk has been called liquid gold to emphasize its value. You have mentioned many health benefits. You've also mentioned environmental benefits of breastfeeding for the mom and baby and the communities we live in. Are there other benefits to breastfeeding? What makes it liquid gold?
Speaking to breast milk as being liquid gold is that it is rich in nutrients and antibodies and growth factors that are crucial for newborns' development and immune systems. I think also it can be difficult, as we've heard a little bit about, for everyone to breastfeed. So it's a high demand as well.
Right. With breast milk, why it's called liquid gold is, like Jessica said, there's so many benefits that you cannot replicate and duplicate. You cannot, no matter how hard companies try, they can't get those live ingredients that breast milk provides. Breast milk is so important that, especially for preemies, that hospitals actually purchase donated breast milk from the Human Milk Banking Association to give to their preemies. And several hospitals are doing it across Montana, because in preemies on donated breast milk thrive, they are healthier and are discharged earlier. It is so valuable that Human Milk Banks, and there's like several across, or quite a few across the United States, what they do is they take donated milk from mothers that have an excess, and they actually interview the mothers to make sure they have good health backgrounds. They take it, they process it, they sterilize the milk, and then they actually sell that breast milk back to hospitals. And that an ounce of breast milk can cost between $4 and $6 per ounce. When we talk about like how much is breast milk. So if you were to purchase it, it's between $4 to $6 for an ounce of breast milk, right? And we're thinking that babies can take 3 to 4 ounces, depending how old they are, per 5 ounces, sometimes 6 ounces per setting. Imagine that cost adds up. So we can look at the human benefits of breast milk, all the health benefits for moms and babies and the community and the environment. But also the cost of it is because it's so helpful and so valuable.
And so you talked about milk sharing practices and the formal practice of giving to donors and then pasteurizing the milk and then selling it back to the hospitals in order to give to mothers at the hospital. Are there informal ways? Can anyone share milk back and forth? What are the risks of that?
Informal milk sharing is the sharing of milk not through a certified human milk bank organization. And informal milk sharing can look many ways. It can be between friend to friend. They're like, I have some extra milk in the fridge for my newborn. Do you want some? It can be, and there's also kind of, also can be on the internet saying, I need milk. There can actually be collectives where it might be like a Facebook page where people are sharing milk that way. But informal milk sharing does come with risks. We can look at the risks of the transfer of diseases that the donor might have. Also, are they taking medications? How is that breast milk handled? So informal milk sharing is it can be risky. If you go to the Academy of Breastfeeding Medicine, they have a policy on informal milk sharing and how organizations can do it safely and effectively. But right now, because of the unknown and the risks, we can't condone informal milk sharing.
Earlier, Jessica mentioned there are other things you can do with milk. So sometimes, like regular cow's milk in the fridge, it goes bad. Or maybe the mother was sick. What are other ways you can still use this valuable breast milk in order to support the health of the baby?
Well, just to clarify, if a mother is sick, so if she has a cold or the flu, she still can breastfeed her baby, and she should, because at that moment that mom becomes sick, she starts making antibodies to fight that sickness. And so she passes those antibodies while she breastfeeds to her baby. So the chances of her baby getting that illness are less or not at all. So in most situations, mom can breastfeed when they're sick. There are certain parts where if mom's has lesions on her breast, if she's taking certain very few medications, there's not a lot, she can still mostly breastfeed through them, that a mom can't breastfeed. But I just wanted to make sure that if a mom's sick, you can still breastfeed. In fact, actually doing your baby good.
Does breast milk go bad? And if it does, how can you still use it?
Well, breast milk can go bad. There are certain storage guidelines. You want to keep it in a freezer. You want to thaw. There's certain ways you need to thaw breast milk. And once it's out and about, after it's thawed, it can only stay at room temperature for a certain amount of time. So sometimes you do have to get rid of breast milk, which is so hard to put after mom has pumped all that to pour it down the drain. But there are, after like regular milk, it can go bad after a while. It's pretty shelf stable breast milk, but there is a amount of time that you can't use it, especially if the baby's using it through a bottle and they take a sip of the breast milk or formula through the bottle and then you leave it. You can't let it sit around because that bacteria does transfer from the baby's mouth into the bottle.
A question for Lacey or Nicole. In the hospitals where WIC or the clinics where WIC is providing breastfeeding support, are most of those certified lactation counselors? Are they peer counselors? What does that look like?
So most of our WIC clinics are actually public health departments. We do have a couple of agencies that may be hospitals or other health facilities in those communities, but the majority of them are public health departments. So we don't generally provide services right in hospitals. What we do is have them come into the program, make sure they're certified and get support from our staff. A lot of our staff do have CLCs because we do support that. And actually, when we have funding available, we reach out to staff that do not have their CLCs and ask if they are interested in taking the course. And we do a lot of additional support and education around breastfeeding. As Terry talked about, we coordinate with them with the Breastfeeding Learning Collaborative. And, this year we had 80 some staff of our 140. So we actually get the majority of our staff to attend a lot of the different breastfeeding trainings. But most of our support is through our WIC clinics with our breastfeeding peer counselors. They generally do that through text messages or through phones or our secure platform with our moms or with our families. And that can be in off hours on weekends. But again, those services are still provided through our actual WIC clinics.
Terry, you shared a story earlier. Lacey and Nicole, is there a story you would like to share about the success of WIC or providing services to someone?
Sure, I'd be happy to share. We actually had, I think it was in 2017 or 2019, we had a short video made of a family up on the western side of the state that talked about how without WIC, she wouldn't have been able to make it through nursing, through her nursing school. And that with the help of the lactation counselors and the WIC program, she had the support she needed to be able to finish her degree, become a nurse. And so that video always kind of sticks with me. And, when you have your hard days, it's always fun to kind of pull it up and watch them and just remember why you do what you do to support the families.
So I remember when I had my firstborn, I was pregnant. I am kind of a keener. I read everything I could about breastfeeding. I was a breastfeeding guru. I was actually more worried about the breastfeeding experience from just all what I'd heard than actually the birthing experience. And as I've grown on in this profession, I realized that that's actually not uncommon for families and moms to be more nervous about breastfeeding just because of the stories they've heard. So I go to the hospital, have my baby, and I'm prepared with all this knowledge, book knowledge, and breastfeeding was really, really difficult. There were just many different reasons. My baby was a little sick. She had a really low heart rate and low respiration. So she couldn't just kind of figure out all the breastfeeding stuff to latch on. I had some issues, and I remember feeling at the time that this was the first thing I should do for my baby, and I couldn't do it. I couldn't do the very first thing to be a good mom. And as I have grown on in this profession, like I said, I've heard that again and again. So I decided, you know what? I decided like there wasn't a lot of help at the time, and I decided to go be the change that you want to see in the world. And I said, you know what? I'm going to go become a certified lactation counselor. And I became a certified lactation counselor. And then I said, you know what? I'm going to go work for our local WIC department, and did that. And then I became an IBCLC, and now I get to work with breastfeeding families across the state. It's like one of the greatest honors of my life. And I want to say, fast forward, that was 19 years ago. My baby was breastfed and bottle fed. And now she's 19, turning 20. And this bottle fed baby is very smart, going to an amazing school. And she was on formula, and all the worries that I had back then for bottle feeding did not come to fruition. And I want to say that there are so many more resources for our families in Montana. There are so many more, whether that is in their health departments, at their WIC offices, at their hospitals, online, telehealth services. There are so many more resources available for moms. And with that, currently in Montana's breastfeeding initiation rate is up there. It's at over 90%. And that's just through all the amazing work that our organizations are doing across the state.
Thank you for sharing that, Terry, and for being vulnerable with us today. We know that these stories are really powerful for our listeners, so we appreciate hearing those real words from you, and how that led to your career and what you love to do today.
I wanted to take a chance to tie back to, I know we started off talking about World Breastfeeding Month and Week, and the topic being environment. And I wanted to speak to that, as in creating a breastfeeding friendly environment also includes all of the different levels. So you have the national, the health level, the workplace, the community. And if anything has gotten out of this podcast, I hope individuals realize that there are resources out there, and to support individuals who wish to breastfeed. And even if your first experience isn't, ideal, there are additional resources out there. And personally, I know individuals who, with their first child, they struggle, but they learned over time that there were additional resources in place that could help them, and they were able to later successfully breastfeed additional children that they had. So just knowing that those resources are out there and being open to reaching out, I think is something that I really hope individuals are able to take away from this.
Thank you for listening to the Talking Health in the 406 podcast, where we are one community under the big sky. I am your host, Mackenzie Jones. We'd like to thank our guests, Jessica Keckley and Terry Miller with the Nutrition and Physical Activity Program, and Lacey Little and Nicole Bullock with Montana WIC, for sharing their experience and expertise with us. If you would like more information on what you heard today, visit our website at talkinghealthinthe406.mt.gov. If you haven't already, please remember to rate, review, and subscribe. Thank you, and have a wonderful rest of your day.